Bachelor of Science Nursing Microbiology Unit 4 Serological Tests. Serological tests are diagnostic methods that detect the presence of antibodies or antigens in a patient's serum. These tests play a crucial role in identifying infectious diseases, immune disorders, and blood compatibility. Principle of serological tests. Serological tests work based on antigen-antibody interactions. When a specific antigen enters the body, the immune system produces antibodies against it. These antibodies can be detected in the serum using various laboratory techniques. Types of serological tests. Agglutination tests. These tests involve the clumping of antigens and antibodies, which can be observed visually or under a microscope. Slide agglutination test, used for blood grouping and bacterial identification. Tube agglutination test, Widal test, detects antibodies against Salmonella typhi in typhoid fever. Latex agglutination test utilizes latex beads coated with antigens or antibodies for rapid diagnosis, e.g., CRP test, rheumatoid factor test. Precipitation tests. These tests involve the formation of an antigen-antibody complex in a gel or liquid medium. Radial immunodiffusion measures specific proteins in serum. Auch-Toloni double diffusion, used for fungal and bacterial antigen detection. Complement fixation test, CFT. This test checks for the presence of antibodies by assessing the ability of an antigen-antibody complex to fix complement proteins. It is used for diagnosing infections such as syphilis. Enzyme-linked immunosorbent assay, ELISA. ELISA detects and quantifies antigens or antibodies using enzyme-labeled antibodies. It is commonly used for HIV detection, hepatitis B and C diagnosis, hormone level measurement, immunofluorescence assay, IFA. This method uses fluorescent dyes to label antibodies, helping in the detection of specific pathogens under a fluorescent microscope. It is widely used for detecting Treponema pallidum, syphilis, and Plasmodium, malaria. Western blot test. This confirmatory test is used for HIV detection. It separates proteins by electrophoresis and identifies specific antibodies against viral proteins. Neutralization test. This test measures the ability of antibodies to neutralize a virus or toxin. It is used in diagnosing rabies and poliovirus infections. Rapid Diagnostic Tests, RDTS. These are point-of-care tests that provide quick results, commonly used for malaria, dengue, and COVID-19 diagnosis. Applications of serological tests. Infectious disease diagnosis helps detect bacterial, viral, fungal, and parasitic infections. Blood grouping and compatibility testing, essential for blood transfusions and organ transplants. Autoimmune disease detection identifies antibodies associated with autoimmune conditions. Vaccine development and efficacy monitoring measures immune response post-vaccination. Conclusion: serological tests are valuable tools in clinical microbiology for diagnosing diseases.